ನೋಡ್ಕೊ ಬಂದೆ ಮಂಡ್ಯದಲ್ಲಿ ಐತೆ. ಹಾ ಅವ್ರೇನಾದ್ರು ಅದು ಸ್ಟೇಜ್ನು ಹೋದ್ರೆ ನೋಡ್ತೀನಿ ಸಿಚುವೇಶನ್ ಹೆಂಗಾಯ್ತದೆ ನೋಡ್ಕೊಳ್ತೀನಿ ಅಂತ. ಹ್ಮ್ ಅಲ್ಲ ಸ್ಟೇಜ್ ಯಾವಳೇ ನಾನು ಅಲ್ಲಿಗೆ ಹೋಗ್ತೀನಿ ಅಂತ.
ಅಕ್ಕ ಇದೆಲ್ಲ ಗೂಗಲ್ ಮೀಟರ್ ಸೌಂಡ್ ಬತ್ತಲ್ವಲ್ಲ, ಸೌಂಡ್ ಬತ್ತಲ್ಲ.
Good afternoon to all. Please wait for a while. We are admitting participants, and once enough participants are admitted, we will start the program in a very short while. Maybe another 5 minutes, 5 to 10 minutes, we will start the program. As we are admitting the participants, just please be patient with us. Please wait for some time. We will start the program in 5 to 10 minutes.
కాదు కాదు
Hello?
आप कैसल माउंट करके
कल गाड़िया परसों
A very good afternoon to all. सभी को नमस्कार. अभी हम अपना प्रोग्राम शुरू करने वाले हैं. We are about to start our free webinar on the occasion of World Down Syndrome Day. Before we start the program, there are few instructions which I want to tell to all of you. Please follow the online meeting etiquette. Okay. We would request you, all of you, not to share anything while the presentations are going on. जब presentation हो रही है, please कुछ मत आप अपना screen share मत कीजिएगा. Because that will interrupt the speakers, and we are expecting more number of participants to join in this program. So by any chance, if you get disconnected from the Google Meet due to overload, if you get disconnected, you are disconnected from the Google Meet, I once again request you to connect from the YouTube live link. And we will put in the chat box. Repeat India YouTube channel. अभी से ये विनती कर रही हूँ कि कृपया आप अपना मोबाइल शेयर मत कीजिएगा स्क्रीन को और अपने माइक को म्यूट रखिएगा. Please keep your mics mute. And we are about to start YouTube live also. There are many people who are connected to us in the YouTube live. अगर किसी भी कारण की वजह से आप Google Meet से बाहर हो जाते हैं तो आप रिपीट YouTube इंडिया चैनल के ऊपर आप कनेक्ट हो जाइए. ये पूरा वेबिनार उसमें लाइव आ रहा है. ओके. The majority of the instruction will go on. Today's sessions will be taken in English. If you have any doubts, we are going to have a panel discussion at the end of the sessions. Panel discussion में आप हिंदी में भी सवाल पूछ सकते हैं, इंग्लिश में भी पूछ सकते हैं, तेलुगु में भी पूछ सकते हैं. Have expertise in these languages and we will be able to clear your queries. Okay. Are we ready to go YouTube live? Shravan sir? Shravan sir, is YouTube live? YouTube live on?
Shilpa madam, tell me.
Are we going YouTube live? Is the YouTube live ready? Okay, I think we are ready with the YouTube live. So we will start our program. I request one and all to please mute your mics. Ali, please mute all the mics because this is our YouTube live telecast. Please mute everybody, Shravan sir.
నాదేం మొత్తానికి పోయింది. You can call Sarah. No, I think Sarah is waiting. Shilpa madam.
Okay. Yes, I am calling sir. Once again, a very good afternoon to all of you. On the occasion of World Down Syndrome Day, we are organizing this free webinar for parents, professionals, and all other stakeholders. And I would now like to request and invite our director, Shri Kumar Garu, to address the gathering on this occasion. Over to you, sir.
Very good afternoon. Thank you, Dr. Shilpa. And before I address, I would like to ask Umesh Kumar Shuklaji from National Trust. Shuklaji from National Trust. You can ask if the JSN CEO from National Trust is joining.
Okay. I can see Umesh Kumar, sir, but his mic is muted, sir.
Anyhow, we'll go ahead because we don't want to waste time of participants. Okay. Very good afternoon to one and all. In fact, at the outset, the initiative for conducting this webinar is to reach out to people across the country. And as you all know, National Institute for Empowerment of Persons with Intellectual Disability is actually observing this World Down Syndrome Day, not only at its headquarters in Secunderabad, but also through its various regional centers at Delhi, Bombay, Calcutta, and also at its composite regional centers at Davangere and Rajnandgaon and also Nellore. So the idea is of observing this day, as you all understand, and because most of you all must be professionals and also parents, is to create awareness. We all know Down syndrome is a condition and it is caused due to an extra chromosome and all. But generally there is, some sort of misconception among people that it runs in family, and it may be because of the, some deficiencies in the generally we see in cases where we get a NIPT. maybe there's some problems with either of the partners, that's the male and the female partners, and especially most of the blame is only at the female partners. So basically, it is very important that first we need to understand what Down syndrome is, what are the causes, and how to get it diagnosed, and how to address and actually, sort of minimize the risk of any medical oblique, the developmental issues which actually creep up with Down syndrome. Today, actually, this lecture will have a lot of inputs from different type of professionals. The medical professional who will start with, and he will give out the reasons, positive factors, and all the issues related to Down syndrome. Then we also have the rehabilitation professional experts actually who are in the field and who have been extensively working day in, day out with Down syndrome children and adults. And they will also give you the various aspects of rehabilitative approaches, that is the speech, OT, PT, and the early intervention requirement. Coming to the early intervention, I would like to stress upon, see, Down syndrome actually, once with the condition when it is, onset, what happens is there are a lot of health issues which actually creep up. Also, there are a lot of, neurodevelopmental issues which come up. So it is very important that, and Down syndrome is generally associated with mild or sometimes even moderate intellectual disabilities because of the neurodevelopmental issues which happen. So it is very important that as professionals, as parents, and in the general public who are actually joining in here, it is very important to emphasize the need of actually, the early intervention. As you all know, the Department of Empowerment for Persons with Disabilities has set up 14 early intervention centers across the country, and NIPID and its 3 of its CRCs have 4 of them. And the idea of these early intervention centers is actually to create awareness and give the intervention at the earliest possible time. Because most of the time, especially with neurodevelopmental disorders, it is very, the first 1,000 days, the first 1,000 days are very important. And that includes the prenatal, So it is very important that awareness is the crux of actually, it is the crux for actually, limiting any effects or, any disorders, especially like Down syndrome. So with these few words, I would like to state that, first of all, thank you all for joining this. And I'm very sure you will take this forward. And today we have actually, through this meet, we have a very limited number of people who can attend this program. That is up to 500 people. So what we have done is we have actually made a YouTube link. And I believe the organizers would surely tell you that, the YouTube link people who are actually joining, they can put in their questions typed so that, the organizers can actually, the concerned expert speakers can address your issues. And if they are not addressed, you can also email to us so that at a later stage, all your queries, questions, and any sort of information what you need would be addressed. Thank you very much. And I know you're all looking forward for the talks to begin. And Dr. Shilpa, you can take it forward. Thank you.
Yes, sir. Thank you, sir. Thank you so much, sir. And once again, we are telling all the participants, because of overload of participants in the Google Meet, by any chance, if you get disconnected from the Google Meet, please connect through the YouTube live link channel, that is NIPID India YouTube channel. आप बस NIPID India बोल के YouTube में टाइप कीजिएगा, आपको ये प्रोग्राम लाइव में दिखेगा. तो अगर by chance disconnect हो जाते, because there is a lot of overload on the, many participants are trying to connect it, and that is the reason I am again repeating NIPID India YouTube channel. And we also extend our very warm welcome to all the viewers who have connected to us in the YouTube live channel. Very warm welcome to all of you. If you have any queries, please type in the chat box and we will try to resolve those issues. And you can also type your questions in the YouTube chat box as well as in the Google Meet chat box. Now let us start today's program. Our first session. The first session will be taken by Dr. V. Shravan Reddy, who is Assistant Professor in Psychiatry and presently heading the Department of Medical Sciences at NIPID, and he will be talking about medical aspects of Down syndrome. Over to you, Shravan, sir.
Thank you, Dr. Shilpa Madam, for the introduction, and thank you, Director Sir, for the inaugural address.
Yes, the PowerPoint is not visible. You can make it full screen, Dr. Shravan.
Is it visible, madam?
Yeah, it is visible, but make it full screen.
Full screen.
Full screen. Request all the participants to please mute your mics.
Shilpa madam, is it visible? Full screen.
No, it is not full screen. Please make it full screen. No. Please
PowerPoint is visible, but make it full screen.
full screen. F5. Press F5. Ali, press F5.
F5.
Is it visible, Shilpa madam?
No, it is still not full screen.
Ali, do. Ali, you are here. Ali is there. He is
100% పక్కన 100% పక్కన కప్పులా ఉంది కదా, నొక్కితే ఫుల్ స్క్రీన్ అయిపోతుంది. దాని పక్కన తప్ప నొక్కండి.
Is it okay? Shilpa madam, is it visible now?
Full screen. There you are. Full screen. Sir.
Yes, sir. Visible, sir. Visible.
Please then.
Yes.
Oh, good afternoon, sir. Good afternoon, everyone. I welcome you one and all for this today webinar on the occasion of the World Down Syndrome. As you all know, every year on 21st of March, we are celebrating this World Down Syndrome Day. So the main motive to celebrate this day is, and worldwide we are celebrating this day. And the main motive and the reason behind for this day is to create awareness among the general public, stakeholders, and also for the inclusion of the persons with Down syndrome, and also advocacy, and also for the rights of persons with Down syndrome. So generally the Down syndrome, this term was first coined by British scientists in 1896. It was the scientist, the pioneer who coined the word Down syndrome is John Langdon Haddon Down. So in 1896, the British physician coined this term Down syndrome. As you all know, the many parents ask what is the cause for the Down syndrome. So generally Down syndrome is a chromosomal anomaly condition, as earlier our so with an incidence of 1 in 800 to 1000 live births in all races and economic groups. So Down syndrome is not only limited to one country or one region or one race. So Down syndrome, you can see worldwide around the prevalence is about 1 in 800 to 1 in 1000 live births. So throughout the all races and economic groups, we are seeing irrespective of the financial, race, country, and other factors. So generally it is caused by trisomy 21 because presence of the extra chromosome on chromosome 21. So there are different causes. So generally the very common cause we talk is the trisomy 21. So this is an extra 21 chromosome is present. Is attached to the nearby other side chromosome like chromosome 14 or 22 or some other chromosome. It is called as translocation. And in the medical term, we call it as a Robertian translocation. So one part of the chromosome is attached to the other chromosome. So that is called as translocation. Even 3 to 4% of cases of Down syndrome are due to the translocation. And other thing is the mosaicism. So this is because of the error in the cell division in the meiosis. Okay, no? So generally some cells have 47 chromosomes and other cells have 46 chromosomes. So this is a reason for Down syndrome in 1% of the cases. It is very, very rare. So this is a Robertian translocation, what I'm talking. One chromosome is attaching to the other chromosome. So you can see this is a karyotype. So generally, how do you diagnose Down syndrome medically? So by seeing the patient itself, by seeing the clinical features, by seeing the examination and some clinical features, we can say that the child is having Down syndrome. But for the confirmation of the Down syndrome medical is the karyotyping. So its karyotyping is nothing but it's in a small blood test like what we are doing for other common blood tests like CBP, other tests. So they draw a blood sample and they centrifuge, and also under the microscope, they see the cells under the high magnified microscope. So there you can see the trisomy. You can see with this red line underlining, you can see the circle. So you can see in all that there are only two chromosomes. Here there is one extra chromosome. So that is called as trisomy 21. So when we look under the microscopy,
Dr.
we can
Shravan, sorry for interrupting. Your slides are not moving, I believe.
Please see Ali. Now it's coming.
Yes.
Now
Yes, sir.
it is coming.
Okay, sir. Okay. So you can see this is the trisomy 21. You can see this is a blood test where we take and keep under the microscope after centrifugation. So we can see this is a red line, what we underline, we can see that is the extra chromosome. So this is a confirmation of the Down syndrome. Okay, no, this is how you confirm the diagnosis. Clinically, you can see the clinical features, examination, you can say that the child is having, but the confirmation is by the karyotyping. Okay, no. So what is the risk factor? So this is a very common question asked by the many parents. So what is the reason for the Down syndrome? So one is it's purely genetic cause. Okay, no. Another thing is a chromosomal, extra chromosomal, what we are seeing. But there are certain risk factors for the trisomy, for this Down syndrome. So depending on the maternal age, so the mother's age, suppose if the mother's age is 15 to 29 years, the risk for Down syndrome is 1 in 1500. If the age of the mother is 30 to 34 years, the risk of Down syndrome is 1 in 800. If the age of the mother is 35 to 39 years, so when they're planning for pregnancy at this age, the risk is 1 in 270. So if it is above 45 and above, you can see the 1:50 ratio. So depending as the maternal age increases, so when the mother got married and when you're planning for the late pregnancies, so as the maternal age increases, there is a high risk for developing Down syndrome. So the risk factors is the advanced maternal age, particularly below 35 is the ideal age to get married and to conceive. And you can prevent the Down syndrome in majority of the cases. And also when you are having a first child already with Down syndrome, so you are already having some genetics. So when you are planning for the subsequent pregnancies, there is a high risk that you may have another child with the Down syndrome. So you should go for genetic counseling and genetic testing, and we can do some antenatal test in the pregnancy. So where we can identify the Down syndrome. And also parents who are the carriers of the Down syndrome. So these all are the risk factors to give birth to a baby with the Down syndrome. So generally, what is Down syndrome? So this is, we are talking, it's a genetic condition, it's a medical condition. So generally, Down syndrome is also associated with developmental delay, like mental retardation or other neurodevelopmental delays. You can see there is delayed in the milestones and there is delay in the cognitive ability, particularly the IQ levels. And also there are challenges in the physical growth and also particular set of facial features. So by seeing the external features itself, you can say this child is Down syndrome. And particularly, this is very, very important. Majority of the cases of Down syndrome, they are having mild to moderate IQ. They come under mild to moderate intellectual disability or mental retardation. So most commonly, the IQ of a Down syndrome is around 50, and compared with none of the sounds. And also they have open mouth and mouth breathing, particularly because of the small mouth and large tongue. And you can see the upward slanting eyes in a Down syndrome child. And also the cheeks are very, very round, you can see. And also the muscle tone is poor. So they have hypotonia in Down syndrome children. And also the ears are small ears. And you can see in the pictures, you can see the small wide hands for a child with Down syndrome. And you can see the middle line. This is called as simian crease. So generally we are having many lines, but it's when you are observing a clinical, by seeing this simian crease, sandal gap, a small mouth, large tongue, eyes, there are certain spots in the eyes. They are called as Brushfield spots. So when you go for the ophthalmology examination, you can find some spots in children with Down syndrome. That is called as Brushfield spots, you can see. And also on the soles of the feet of the Down syndrome, you can see some lines. And also you can see the joints are very flexible. The movement of or the joints are very flexible for a child with Down syndrome. And also you can see the height is little less in children with Down syndrome or adults. So when compared with the normal or other developmental delay, there is a challenges in the height, weight, and growth parameters. So generally, Down syndrome children are little short stature when compared with the normal children. So this is a brief idea. I'm not going into the medical part, but there are many medical complications in a child with Down syndrome. You can abdominal intestines problem, hernias, what we call, and also the muscle tone is less, and you can have intestinal obstruction. And also in children with Down syndrome, you have feeding problems. Suppose when you are feeding with Down syndrome, there are high chances of vomiting, taking the food out, and also you are having heart problems in a child with Down syndrome, particularly you can see in the common man language we call the heart valves like atrial septal defect, ventricular septal defect. So for all these things you require corrective surgeries. Children with Down syndrome, heart problem, all these things. So these are the very common medical. You can see the with the figures. You can see semen increase, the sandal gap, water, all these things. So these are the common Down syndrome. These are the external features. And also when coming to the teeth part, you can see the development of temporary teeth and the permanent teeth. When compared with other children, generally Down syndrome, you can have the problem with the dental issues. The temporary teeth and the permanent teeth, they have, you can see late development. And also the position is different, okay, no? And also you are having few teeth and also habit of breathing through the mouth. What we call is the mouth breathing. So they feel that they are not having enough oxygen, and you can see mouth breathing in children with Down syndrome. And also particularly you can see mild to moderate mental retardation in children with Down syndrome. So that is the reason we identify them at an younger age and start early intervention and all the skills for them. And other defects, what we see commonly is a congenital heart defect. So this is the thing what we are talking. Particularly many children with Down syndrome, they have holes in the heart. What we say is the common is the atrial septal. So because of this, there is a less oxygen supply in the body of the children with Down syndrome. And also coming to the gastrointestinal tract, your umbilical hernias and also obstructions. You can see duodenal atresia. So what we call is obstruction in a common term, intestinal obstruction. So there is high chances of vomiting and regurgitation in these children. And also in the Down syndrome children, there are high risk of developing infection because of the less immunity and also you can see hypothyroidism very, very common. The low levels of thyroid you can see in a child with Down syndrome. And also that is the reason we want to screen every child with for thyroid, hearing and vision. So whenever a child is coming with a Down syndrome, you want to check the hearing also. So you want to check the sensory hearing loss or mixed hearing loss, all these things. And also you want to see the vision impairment. Particularly many children with Down syndrome, they have less vision. So to correct the refractive errors, you want to show the detailed ophthalmological and refractive examination want to do. And also rarely they may have developed blood cancers, particularly leukemia in Down syndrome. And also because of less muscle tone, they have challenges in developmentally like sitting, walking, standing, and also the posture. And the talking is also delayed, speech is also delayed in Down syndrome. When coming to the antenatal diagnosis, there are certain tests you can confirm that the child is having Down syndrome. So you want to do some scans in the mother when the baby is like fetal scans. You can see double bubble appearance and also 2D echo. Heart scans, you can find the AV canal defects and also X-rays. And also after delivery, by what we discussed is the clinical examination by seeing the signs, and confirmation is by the karyotyping, that what is the chromosomal evaluation. So this is the complex by many professionals. So you can prevention is better than, so there are many blood tests that we can identify in the pregnancy. They are nearly 85 to 90% accurate this test and also antenatal scans. So by doing simple blood test in the mother, by taking the mother's blood sample in the first trimester or second trimester, we can say that the mother is high chance that there is giving birth to baby with Down. These are the certain parameters. One is the pregnancy associated plasma protein. The thing is the beta estradiol, you can see alpha fetoprotein and inhibin. So these are the. So when you take the mother's blood and do in the first trimester or second trimester, so there is a high chances that there is a positive for the Down syndrome. So then there is another antenatal scan in the ultrasound. So based on that also we can identify that the baby is having Down syndrome. So whenever these parameters are abnormal or something normal, so you can go for the termination of pregnancy. So that's why you should go for a good gynecologist or those who are having better experience in the antenatal particularly. So by this test, when these parameters are increasing, you can go terminate the pregnancy and you can confirm with these three. So these are the preventive screening tests. Another thing is the amniocentesis we can do. Suppose some couple are coming late, around the first trimester was over. So you are coming, certain couple are coming late and they want the scans that they know, they want to know whether the child may be having Down syndrome. So we can do by amniocentesis also. Amniocentesis is nothing but we'll insert a small needle into the amniotic fluid. So we'll take the amniotic fluid. In Telugu we call it as Ummaniru. So we insert a needle and we take a amniotic fluid. And that in amniotic fluid we send to the lab. So in that they will find out any abnormal cells are there. So with that also we can identify any Down syndrome chances. And also we can do the chorionic village sampling also. So where when the placenta, which is attached to mother to the fetus, so from the placenta also we can take some kind of a biopsy like that, this placental villi, and you can find whether Down syndrome is there or not. So these are the antenatal screening by which we can prevent the Down syndrome. And also nowadays there are newer techniques like whole DNA sequencing, and also by the fetal DNA also we can know whether Down syndrome is presented there or not. So this is very common questions. What are the complications or the prognosis of a child or adult with a Down syndrome? So generally in Down syndrome there is higher chances of developing dementia. Dementia is what? Forgetfulness. So generally it occurs with age. But when compared with the normal population, generally the adults with Down syndrome, there are high chances of developing dementia. Around 1 in 4 out of 4 individuals, 1 individual develop Alzheimer's disease with Down syndrome. So what is the treatment of Down syndrome? Particularly the main treatment is the early identification and early intervention. So particularly early intervention is very, very crucial. As you know, in the first 3 years, 75% of the brain development and myelination occurs as with other developmental disabilities. And by 6 years, 90% of the brain development. So we want to identify which areas the child is lacking. Suppose there is a problem in the gross motor, fine motor, speech, the child is having sensory issues, or there are problems in the tone. So depending on what problem is there, our early intervention team will assess and give the appropriate interventions to the parents. And with this, the parents can train the child at home. So you can see improvement in the cognition, speech, muscle, tone, all these things. And also identify and refer family or caregivers to the financial and the medical support programs. And also development of individual educational plan is very, very important. So each child with a Down syndrome, they have different challenges, they have different deficits. So whenever we are giving treatment protocols, so based on the child needs, we prepare a standard curriculum and give interventions to the child. So as I discussed, early stimulation is very, very important, like physiotherapy, speech therapy, occupational therapy.
Dr. Shawan, we are not able to see your slide. So just unscreen and again share your screen.
Ma'am, we'll get the PPT.
Yes. May I know?
And is it, are we going to get CRE points for this workshop?
No. This is not a CRE program, madam. This is an online webinar for creating awareness. Okay, so this does not have CRE points.
Okay, but you will mail us the PPT, right, ma'am? I've mailed.
We will keep these PowerPoints and all will be available in our YouTube India. The entire thing is getting recorded. You can listen to it whenever you want.
Okay,
Yeah, we are able to see the screen now.
Yes.
Yeah, I think you can continue, Dr. Sharma. Dr. Shawan, please open the PowerPoint.
Yes, madam. Ali is doing. Now you can see Shilpa, madam.
No, not yet.
Ali?
Yeah, it is now. Yeah, now it is visible.
Okay.
It is visible.
Now you can see Shilpa, madam.
Yes, it is visible. Sir, you can continue.
So these are the management, particularly the management of Down syndrome is the early stimulation. So what are the identifying the risk factors, whether the problem in the cognition, gross motor, fine motor, or speech cognition. So based on the deficits, our early intervention team will identify the children. So and they give the therapies and they train the mothers, and then we can have a regular follow-ups. And also for the hypotonia, you can have physiotherapy exercises. And particularly antioxidants like zinc supplements can be given as there are high risk for developing dementias like Alzheimer's disease. And also in many children with Down syndrome, they have epilepsy, fit, seizure. So we can start with anti-epileptic drugs. And also we have for like heart defects or heart holes or for hernias or abdominal obstructions, you can go for corrective surgeries. And also as many children with Down syndrome, they have refractive error problems. So this can be corrected by the lenses. And also, as we told, there is a problem in the speech and communication in a child with Down syndrome. The speech therapy is definitely required. And also, the many children with any Down syndrome, they have iron deficiency anemia. So we can use iron supplements and appropriate nutrients. In majority, they are having the hypothyroidism. So by simple blood test, we can identify whether the thyroid levels are normal or not. So if they are having low levels of thyroid, we can start with the thyroxine supplements. And also, many children with Down syndrome, they have eczemas and allergies. So which can be given antihistamines, moisturizers, lotions, and appropriate therapies. And also the low cholesterol diet and also the immunodeficiencies you can correct by giving vitamin C's and antibiotics. And also as a basic protocol, you want to screen all children with Down syndrome for the hearing test at birth and by 3 months of age and also regular follow-up. And also as there is a less chances of developing these blood cancers, leukemias, you can do the simple blood counts. And also you can go for thyroid evaluation and also 2D echo to rule out any heart holes or congenital or cardiac defects. And also you can, as I told, there was a loose joints and ligaments in a child with Down syndrome. So you can go for the X-ray, any dislocations or any problems is there. And also many children and adults with Down syndrome, they have problems with the sleep and they are having sleep apneas. So which can be corrected by the medication and appropriate interventions. And also eye testing and refraction is very, very important in a child with Down syndrome. And also very minimal invasive surgery to treat the heart defects and the duodenal obstructions. Life expectancy has greatly increased in individuals with Down syndrome. And this is a very common question by the parents or caregivers. So, sir, my child is Down syndrome, whether I can get married or you can give birth to some other. So as a medical professional, we don't recommend marriages for mild or moderate ID, severe profile. Even with the Down syndrome, they come into mild to moderate intellectual disability. And some patients with even the doctors telling they get married in the rural areas particularly. But even after getting married, majority of the Down syndrome, they are sterile because of they are unable to give the offspring. Even they have impairment in the spermatogenesis, in the production of the sperms, they are infertile. So this is the reason they cannot conceive in majority of the cases. However, in 50% of women, they can conceive and give babies birth. But even when they are giving birth to babies, the women with Down syndrome, there are high chances that there is again giving birth to a baby with the Down syndrome. So this should be keep in the mind. So that's why we advise not to get married in a children with Down syndrome or adults with Down syndrome. And also the treatment with the medication, even Down syndrome children, they are having behavior problems, restlessness, agitation. Depending on the need of the child, we start the anti-medications. And if they are having seizures, we start the anti-seizure medication. For thyroid, we use the thyroid supplements. And any corrective surgeries are required, like heart surgeries and abdominal surgeries, we try to correct them to prevent the complications. And also physical therapy, as I am discussing, the many of the children with Down syndrome, they have very, very poor muscle tone. Okay, now this causes very bad posture and low muscle tone. To improve the muscle tone and strengthening, we give the physiotherapy exercises. And speech therapy also we try to give in the Down syndrome. Even they try to talk, but the speech is not clear in many of the individuals with Down syndrome. That what I discussed in the earlier slide, because of the small mouth and enamel tongues. So there is a problem in the production of the sound and talking clearly. This can be achieved to a proper speech therapist and using the sign languages and also the electronic speech communication systems, okay, and the transitional communication system. So you can discuss with a speech therapist, and to improve the clarity and for a better communication, you can get the help of the speech therapist, and also improve the self-help skill like feeding, dressing, grooming, and gross motor, fine motor, and everything. You can go for the occupational therapy, and also play and leisure skills can be improved. And also this, in particularly in the infant stage, particularly 2 to 3 years, they are having much of oral motor feeding problems. Particularly the child is not able to take much feeding. If they take also, they can have warm things. So even to facilitate this stimulation, we can take the help of the occupational therapist. And also for the gross motor, fine motor also, we can take the help of the occupational therapist. And the main important thing is whenever you are seeing as a professionals, when you are seeing a mother or the parents giving birth to a child with a Down syndrome, counseling is very, very important. And there are many misconceptions in the society that Down syndrome can be cured. I'm going to that therapy, I'm going for quack, or I'm going to somewhere. So depending on the region or the quack they are going. There is no cure for Down syndrome. It's a genetic condition. It's by birth and it's a lifetime condition. So the one thing what we can do is the acceptance of the condition and what better we can create for a child with Down syndrome and what are the developmental disabilities in a child with Down syndrome and what interventions we can do and how we can improve the quality of life of children or adults with a Down syndrome. So this is an important thing and we give the medications depending on the comorbid condition and there is no cure for Down syndrome. It's a lifetime condition. So only the preventive part we can do as because of the increase in the medical screening test and good so prevention is better than cure in the Down syndrome and also the counseling of the parents, teachers and acceptance from the society is very, very important. And there are very good people with Down syndrome and VIPs are very eminent personalities. She is Ellie Goldstein, who is a 20-year-old model with Down syndrome. And she was the first model with Down syndrome to give a huge campaign for very international brands like Gucci and Adidas. And she's a British model. Okay, no. And even in Indians, there are many people with high skills in Down syndrome, like Sujit Desai, who is an artist with Down syndrome. He can play at a time all the 7 instruments like violin, trumpet, piano, and drums. And he has given many international presentations and international. So he has done it throughout many countries. Thank you.
Ask.
Yeah.
I'm from Srikakulam district. You audible, sir?
Yeah, I can.
Actually, I've told this is the mental factors of influences to the Down syndrome or not?
So environmental factors also contribute. Mostly it's a genetic condition. Generally, environmental factors trigger the like other developmental delays. Okay, no. So generally, environmental factor is not only for the Down syndrome, for any neurodevelopment like autism, ADHD, mental retardation. So generally, the environmental factors, there are certain percentage of role. Even there are triggering causes. So, but genetic is the main thing. Nearly 90 to 95% is the genetic condition. Okay, no. So it's only because of not the environmental condition, Down syndrome doesn't come. Okay, no. So it's definitely genetic condition and environmental factors has 5 to 10% role.
Is there any aberrations with the normal children to Down syndrome?
What I didn't get you? Is there
any aberrations? Is there any aberrations to the Down syndrome with the normal children?
Averages.
He's talking about any surgery is there to make the Down
syndrome. No. I'm not talking about that one. I'm saying, is there any aberrations to the normal children with the Down syndrome?
I didn't get average. You were telling what aberrations?
Aberrations, sir. I mean, any differences with the compete?
Yeah, definitely. See, Down syndrome, you have definitely differences with the normal children. Okay, no, particularly when compared to the IQ. See, many of the children with Down syndrome, they come into the mild to moderate category. Okay, see, Down syndrome, they call into mild to moderate category. Means you are rank 50 to 75% of the disabilities. And Down syndrome children, they have parameters, problems in the growth, height, weight, and also at the immunity level, and also at the cardiac level, gastrointestinal level. Not each child may not have all the symptoms what we discussed. Okay, no, some may have cardiac issues with Down syndrome, some may have gastrointestinal issues, some may have thyroid issues with the Down syndrome. But majority of the children, they may have one of these conditions. Okay, no, and also the external appearance, physical appearance, what we told mongoloid slant, flat parietal feature with problems in the vision, hearing. So definitely they are having a lot of differences when compared with the normal children. By seeing externally only, I think if you are a rehabilitation professional, by seeing itself only, you can identify them that this child is looking like a Down syndrome. Though you may not confirm the diagnosis, only by seeing physically you can tell them. And the diagnosis will be the confirmation by the karyotype.
Yes, sir. Thank you.
हेलो हाँ सर
Yeah, tell me.
आईपी प्लान 30 इयर्स का बच्चा है उसका आईपी प्लान कैसे करना है सर जो 3 मंथ्स का गोल रहता है
I didn't get you.
आईपी प्लान सर आईपी प्लान करना पड़ता है ना 30 इयर्स का बच्चा है उसका प्लान करना पड़ेगा क्या सर क्या
Yeah,
नहीं
first
करना
thing,
है?
IEP planning के बारे में next session में हम बात करेंगे. अभी ये
ओके ओके
मेडिकल एस्पेक्ट्स के बारे में
मेडिकल एस्पेक्ट बता रहे हैं साहब, एक बात आप IEP के बारे में पूछना है मैडम.
we will take
Dr.
questions.
Shilpa, you can talk on IEP.
We will take questions related to educational programming and IEP after the session on IEP and school readiness programs is over. Currently, we are taking questions on the causative factors, etiological factors, and the medical intervention which needs to be given for children with Down syndrome. We will take those questions once the sessions are over. Okay.
Sir, good afternoon.
Yeah, good afternoon.
I just have a quick question. It's not a long one. I have a Down syndrome case. It is being given and supported by the physiotherapist.
Madam, you can talk a little louder.
Other person is talking, I guess.
Yeah, you can tell me, madam. Now I can hear.
Yeah, the physical therapy and physiotherapists are supporting. She has got some surgery done. Do you think that physical therapy will support her in like basically she's like not very good in walking? I know, I do understand that the basic problems are there, but do you think that the physical therapy will help her out?
Yes, madam. See, one thing is first we want to do the detailed evaluation. What is the problem is having child, whether she is having hypotonia or some other comorbidity she is having or some other genetic condition. So what surgery you have done first that you can tell me? What surgery you have done first?
I think it is abdomen. I'm not very clear about the surgery, sir. But the parent has been like shared only that.
What it's a cardiac surgery or gastrointestinal or locomotor?
No, not the cardiac. But what she is complaining is, if she's at least if she walks for like 1 or 2 steps or something, she will become tired.
Okay.
Yeah.
Where do they stay, madam? If they are nearby Hyderabad, they can come to us. First thing is we want to make a proper diagnosis, sir. So, okay, no. Even in locomotor also, you are having many conditions. What is the reason? So only because of the Down syndrome, see many Down syndrome, they are walking, they are having normal quality of life, everything. Their locomotor part is good only. But if she is having only Down syndrome or some other condition which is causing her inconvenience or restraining from her walking, so that diagnosis we should do.
So associated conditions will be there, right?
Yes, definitely the associated conditions will be there. So we want to do proper assessment. If she is nearby Hyderabad within a nearby state, you can get to our NIPIT center. We have our own team. We are having pediatric ortho and we are having medical doctors. We do the proper evaluation and make a proper diagnosis, and we can give her the proper intervention.
Okay.
Thank
Thank you so much for clarifying. Thank you, sir.
I think we will take one last question from the YouTube channel. We have our participants asking the question. Can we prevent Down syndrome? What are the preventive measures which can be taken to prevent Down syndrome? That is the question from the YouTube participants.
Okay, man. See, first thing is, as I'm discussing in my earlier slides, the prevention is better than cure. Okay, no. See, after the delivery, we cannot do anything in the cases of Down syndrome. So, particularly, there are certain tests in the antenatal. So, when the mother is during the pregnancy time, particularly in the first trimester, in the second trimester, there are certain antenatal tests, certain blood tests. Okay, no. First thing is you want to prevent the late marriages and late conception. Okay, no. What I am discussing in the earlier slide. So, it's better to have your child and marriages before 35 years. As the maternal age increases, there is a high chances of giving birth to a child with the Down syndrome. So first thing is you want to prevent the late marriage. And second thing is when you are having a first child with a Down syndrome, there is a higher chances, there in the next pregnancy, there will be chances. So you want to go for genetic counseling and testing. And other thing is, there are certain blood tests, what I'm telling you, the antenatal and fetal scans we can do. And other thing is the blood test like triple test and quadruple test. It's a simple blood test. What the lab technician will take, like for CBP, what we go for thyroid or sugar test. They take a blood sample and they send to the lab. Double marker test, triple marker test. We are having quadruple test. And also your gynecologist during the pregnancy time in the mother's womb, they see the nuchal thickness, the neck fold thickness they will be seeing. If it is greater than 4 mm, so there is a high chances giving you birth to a baby with the Down syndrome. So generally these all are around 85 to 90% accurate. Okay, no? This triple test, quadruple test, and antenatal scan. So with these 3 tests comparing, if there is any abnormalities in this test, nowadays many gynecologists, your family gynecologist, whomever you are going, they're terminating the pregnancy. So prevention is better than cure. So definitely we are having the markers, antenatal scans, should go for a good gynecologist, and also you want to prevent the other factors, what I discussed earlier.
Thank you, Dr. Shravan. I think we will now move to our next segment.
Madam, sorry to interrupt. I have one question to doctor. We don't mind. Sir,
Okay,
good afternoon, sir. Good afternoon, sir.
you can ask.
Good afternoon, sir. This is Anbu from Bangalore. So I have twins kids, only studying 6th standard. Another only study is not in, is in special school presently. It's a twins. One goes to the 6th standard. Another one is still is going to the special school, ACC special school in Bangalore. So you get 3 years in the speech therapy. Speech delay, not like delay, not at all come to the speech. But nobody can recognize this is a downstream kid. So what is a very good suggestion to further, sir, for my son?
Means physical features, the child is not having any physical features like what I discussed, what I have shown the images.
No, we consider nothing is there, only speech delay. You go for this speech therapy. We given more than 3.5 years.
But his diagnosis is Down syndrome, your child diagnosis is Down syndrome, they have made
Yes, autism they're saying.
What?
Autism.
So not Down syndrome, only autism is having.
Autism is having.
Yeah, see, autism is a very common disorder now. We are seeing the prevalence of autism is very drastically increased, okay, no? Even in the metropolitan or the rural areas.
Yes,
so
sir.
first thing is you want to make a proper diagnosis, whether he is having only autism or autism with ID is having or some other comorbid condition. First thing you make a proper diagnosis. So particularly definitely in autism, the main core domain symptom is speech regression. So there is particularly problem with the speech in autism, okay, no? So
Yes,
just
sir.
you want to go for the speech therapy. See, one thing is if the child is not improving, you are giving intervention, regularly sending to the speech therapist. If you are not seeing much improvement, you want to find what is the reason why he is not improving. Whether he is having only autism or he is having ID also, or even there is a problem with the therapist side, or the child is hyper or not able to focus it for a long period of time, or is not able to follow the commands, or as a parents, what we are training at home, the home interventions, what we are doing. So these all areas we want to look back. See, one thing is you made a diagnosis and is not improving. So we want to recheck your diagnosis, whether it is only autism or some other condition is there. And also the therapists, what we are giving at the center, whether they are qualified or they are. So all these things, these parts we want to assess. Okay.
Sure, sir. Thank you. Thank you. Very good.
Yeah. Thank you, Dr. Sharan Reddy. We will proceed to our next sessions. Our next sessions are on fine motor and gross motor aspects, especially with regard to the Down syndrome. So now I would request Mrs. Kanchan Singh, who is a senior occupational therapist working in the Department of Therapeutics, to talk about fine motor aspects in children with Down syndrome. So she will be talking exclusively from the occupational therapy point of view. Later, we have the physiotherapy view by Shri Rishikesh Deshpande. So participants, please be online and stay connected with us. And I would also request that if you have questions, please you can type the questions in the chat box, and our speakers after the session will also answer the questions in the chat box. Okay. Over to you, Mrs. Kanchan.
Yeah, thank you, Shilpa ma'am. Good afternoon, one and all. I welcome you all in this session. Shilpa ma'am.
Yes, I am here, and please start your share your screen